This client, you had FAI surgery, and you've been through all the PTs and doctors, and you really haven't had much relief, have you?
No relief yet. Unfortunately, it takes a lot of time to heal, and I just haven't been able to get the muscles to work to support me.
So this is his second session. We already did one session. This is a week later, and basically he's got no glute activation. Right? Now, a lot of people, I have never seen a really positive effect from FAI surgery. Most people that get it end up with more problems, or they're exactly the same. And there's another client that's going to come in that we're going to film who had surgeries 5 or 6 years ago, has all these problems, and so we're working through the same things with him. So we're going to show you today is how we're going to get this glute to activate it, the level he's at, and then where he needs to get to. All right, so let's start with the first exercise here. We're going to take this heel here, and we're going to keep it pretty much in line with the back of the butt here. If it goes a little bit behind, that's okay. Go ahead and go way far behind. You don't want to do that, because then it's going to start going into your low back. So you got to keep it here. And then this is going to be really high up on the calf. And let's put this under. And we're going to dorsiflex this foot back. If he points, go ahead and point the toe the other way. If you point, no good. You have to pull that back. That's a good position there. Now we're going to touch the knee on the floor. And we're going to establish this angle here. Does it hurt?
Just inside my thighs.
So the inside of the thigh, as soon as he puts it down, he starts to feel the inside of the thigh. The other thing we're going to do is we're going to get a little arch in his back. And now lift the knee. Tell me if that's too much weight. Let this hip go back a little bit. Do you feel the inside of the thigh? Do you feel here?
Yeah, I'm getting inside.
So his groin's trying to take over right now. So let's just go lighter. Good, lift. So I'm going to have him roll back a little farther. All right. How's that? Better? Just go up and down. It'll turn on. Go down and up. And we're going to try to keep this from moving. Go ahead. See how he's a little angle forward with his hips here.
Yeah, I feel it.
Now he's got it. So this is his zone. As he gets better, the knee's going to go lower. So he just can't come that high. Hold on, just hold it, come on. You're not going to get hurt. Just hold. Bend this in. I've had many clients that have been told they need FAI surgery, and then I get their glutes functioning correctly, and the popping, the snapping, the hip impingement goes away. Now you had 2 FAI surgeries, right?
Yeah, I had 2 surgeries on both hips, and I had a shaving of the bone surgery too.
And didn't really help much, right?
Not at all. I didn't start getting relief until I came to you.
So we've been working together for almost 3 weeks now, and it feels a ton better, right?
Yes, it do. It do.
So he just got the surgery. He's 3 months in. You want to give him any advice?
Please.
What surgery you had?
I had that same surgery, but
That's the same one?
yeah, it's been about 3.5 months since I got it, and I'm like having a really hard time.
Well, I can tell you get surgery.
He's telling the doctor saying you need another surgery.
I need another surgery, which is completely pointless because I've been working on like a month and a half, and I feel like 60% better.
Month and a half, he feels 60%
No pressure.
better.
No pressure. Pressure's gone. Okay.
And the pressure's going on his hip from all the glute work that we've done. But it's how we do the glutes. Like some PTs, it's all a joke. They're not going to get your glutes. They don't even get it firing properly. They do the clams. They do the band walks. It does absolutely nothing. This targets the glutes. All right, let's do the other side. And why don't you start over here, brother? We'll get you going. Got to get that hip angle going. Now on this side, because of the way his hips rotate, is a little bit. That's where you want to be at. I might have to shift him back a little bit. Okay, go ahead. So the mistake he was making when I came over is this foot. Go ahead, put it in front of you. He was like this. You see how it doesn't go into the glute anymore? There. Feel? You push your chest forward and arch your back. You got to get this arch in your back. If you collapse here, the hips are going to move and turn. Can you feel?
Yeah.
He wants to feel it right here on this side dimple. Here, yeah?
Yeah.
He's got it. Just got to be very short. But see how this stays still. Now, I actually, if you come up, I actually cracked my neck of my femur head about 6 weeks ago. I got stem cells and I tore, it's called a circumferential labral tear. So I tore the entire rim of my labrum. Mountain biking fall, and then I just kept training on it, and then eventually I think it cracked and got way worse. And I don't know, I didn't have much pain, so I didn't think of it at the time. But I got stem cells put in, and this is 6 weeks later. Remember, I have a support structure. These guys don't. So my glutes are really built up. But you know, guys, I couldn't even do. I was laying on the couch to try to train you, right? You would go upstairs. So this is 6 weeks in. I don't have any pain. I just have a little bit limited range of motion. So I'm telling these guys too. Like I'm telling him, I got a stem cell clinic. He should be going to the stem cells and get that as well. So see how that heel is just right on the back edge here. All right, now he's going to go down. If you want to get a little lower, babe, I'm going to show this angle. Now, here's the problem right now is his back is way too far behind his body. Slide up, get your shoulder, move a little bit more. Now arch from there. And if you get over top here, so he was, go ahead, go all the way back with your body like you were. If you get too far back behind you, this starts rotating too much here. You put too much pressure on your low back. So slide down. That's where you want to be at. Good. Get your hand behind your head for support. And push your chest forward and stick your butt back. Now we're locked down. And now go ahead. Up. Let's not get extreme angle. Down. Touch the floor. Up as high as you can. Up, up, up. Challenge the top. Feel your glute?
Yeah.
So I'm having him go ahead up and down. He's got it really active over the last 4 weeks, and now I'm having him really challenge the top. You feel that?
Yeah.
So to pass the test, he's got to get about here. He's got to get here with this hip at this angle. Some people have that range of motion, but they don't have the strength. So when they go up high and they keep that angle, they don't feel it here. They feel it in their hamstring, bottom of their hamstring. They feel it in their groin. So he's going to start really challenging now the top end, top challenge. And you can feel it only here, right? So it only feels it here. Challenge it. Good. You got the glute when you started, what did I have you do? Just hold like right here. He would hold, he would keep that hip angle, and he'd go ahead up and down real short. And you just stay really short and low. And he got it really strong, and now we're going to, go ahead. And he got connected, now we challenge it. Feel that? Okay, let's do the other side. That's perfect. So look at how far back behind that leg is right now. We want to get this so it's good. Push. A little more lined up. Heel lined up with that butt. That looks good. The angle looks good. He looks good there. Put the weight on. Dorsiflex his foot back. Nope, this foot. Good. Hand, finger, thumb. I do finger, thumb. If you put the palm, you have a tendency, it's harder to arch your back. That was great. Okay, challenge the top. Go ahead. Up. Challenge. Good. And down and up. I'd say he's a little too extreme. I want you to keep that back a little bit. Now go ahead. And fire it up. When you drop it, don't let that roll forward. Let it down. Yes, like that. Do you feel that? And then challenge that top rank. That's all glute, yeah? So you felt no compensations. Usually if you have FAI, as soon as you do this, you start feeling it in your groin. Okay? So we got it, and you might get 10% when you start, or 20%, but 80% in the right spot. That's what we're looking for. Okay, rest. That's good. Oh my God, look at that climb. Thought okay, Joe? What we're looking at here is, I want this heel here, right in line with the back of the butt. And put the weight down. Just let me have your hand. And you should be able to grab there. Now we're in good position, okay? The problem is if you get out here, it's gonna put a lot more torque on your TFL. We're gonna be right there. He's got a pad underneath, go ahead. we put a pad underneath the bottom leg. That way the knees turn in more and you get more medial rotation. All right, go ahead. This, go ahead, up and down and down. Try to feel the glute. And the key is, with this technique here, a little bit different than the other one, is you want to make sure that this is nice and square. So watch, he's just going to go very, see how you go ahead, up and down. He can't touch his knee right now. If he touches his knee, he loses it. That's pretty good. Stay on that. Go ahead, down, right to there, and back up. If you move this at all, it's going to make it so you can drop another inch. So that's why, you feel it?
Yeah,
And you feel it all in the glute? Yep, right there. So you want to feel this in the same area. If I squeeze my butt together, that side dimple right there. If you feel down low in the hamstring, you're not doing it right, or that's good. Or if you feel it in the groin a little bit, that's okay as
I
long
don't
as
really
you...
feel the groin on this side.
That's good. Let's do the other side.
So
Look, he needs to move. No, turn your top butt cheek down. There. Now that's square. Okay, now move. Stay on this. Go ahead. So he doesn't have much range. It's very hard for him. You feel that? Don't let that move back. Good. Alright, that's good. Alright, so he's at 15 pounds. Go ahead, up and down. He can go to the top of the bench here and down to the knee. And look at that heel. It's right in line with the back of the butt. All glute. That's what we're looking at here to pass the test. So now he's ready for the next level with this. And then there's one more thing we start moving on to after this. It's hard for me to, with my injury, that's about as far as I can sit upright. If I try to go forward, that's where the femur that's fractured starts really hurting. Okay, so we're here like this. Put the weight on. Take the pad away now. Grab it with that hand. Put this here. Roll your shoulder backward. Correct. And now rip that. And now we're going to put it on stretch. I'm going to put that medius and minimus on stretch. Feel that? So get over top, babe, so they can see. So all we did different is, yeah, right there is good. All I did different is I'm going to let his shoulder roll back, so he's got some rotation, and now he's going to start working it there. Feel that? More challenging, right? So that's just another way to get the glute to fire even more intense. And then once he masters this, we start working on this. Once he masters this one, we start working on this punch and getting the medial rotation of the hip from a standing position. And then there's also different things we do for internal rotation. This looks great. Another level with this exercise here, I'm going to show you the next level. But he would get, if he did groin, he would get a pinch up through here. Okay, so when you're doing groin, you want to feel it through the adductor chain. You don't want to feel the pinch up through the TFL, the rectus femoris, the sartorius. That's what he was getting here. So we started him, go ahead. And it was on the side that he had the surgery, well, he had surgery on both sides, but on this side in particular, we started super low with his knee, go ahead, and then he would squeeze. And then show him the next level. And we started bringing the leg up. And then finally he got it up to about there. And he was able to squeeze into that. And that's how I know now. And if you look at our app that we have, we show it a little bit more in detail. I just don't want to spend too much time. But that's the process that we had to start with. And now, sorry, Rafa, he's on here. What we do with this one is we're going to start him around 45 degrees, okay? His feet are going to be below his knees. If he gets his knees too high, no good. We want his feet, and we want to be on the ball of his feet. And we go here, and now squeeze. Simple. Yeah, it's just it doesn't move. And now go too far in when you start feeling the pinch. Go a little closer. Pinch. So he starts getting the pinch here. Go ahead and move back. And that's where he starts, okay? And then in a month from now, he's going to get stronger in this position. There's going to be less sort of the upper part of his hip flexor. And what he's going to do is he's going to try to get to a 90-degree angle with his knee to the hip bone here. But he's starting around 45, and that's how we start getting the adductor chain to function correctly with this FAI. Andy, I showed you the level that Malik was at. Now I'm going to show you, he's just doing this for the first time. Now here's the key here. And we'll, at this foot here, move this in closer, has to be more toward the center line of the body. And we'll show another angle over top. And now, squeeze gently. And he just wants to feel it through here. If he feels it up in the hip flexor, we're going to have to readjust them. I want you to just feel the groin. And this is why he was getting a lot of knee pressure. Just because when you have FAI, I think it's more your sartorius and the TFL, the rectus femoris, and the pectineus. That's really what grabs. It's not so much the adductor chain. So we want to start strengthening up the adductors. That's going to take pressure off the hip because the adductors and the glute medius and minimus work together in medial rotation. So it's really important. You feel it in that? Here, right? Correct. So he feels it in the right spot. As long as he's not feeling a pinch up through here or the side of the hip, we know he's good. Just squeeze in and out. And if you get over top, just so they can see that angle there.
So it's like a pulsing? Or...
Yeah, just rep it. Here, come right here. See how this foot, if I'm gonna move this foot out farther and squeeze, and I bet you lose it. Harder, right?
Yeah.
So move it in. That's where he's got to start, and good. And babe, if you go back. And then once he can get it like Malik had it, where his leg was up, knee to knee here, then we move on to the ball. That's how you do it, because if you start with the ball, it's just going to go right into the hip flexor. Feel? Mm-hmm. Okay, switch. Let's do the other side. That's why your knee's hurting. His knees started bothering him too on the inside. Why? Because we're working the medius and minimus, but his adductor chain is super weak too, so he needs support of all those things. So you're what, 6 weeks in?
Yeah.
He's 6 weeks in, he feels probably 60% better. Generally, with a client with hip injuries, we're gonna look at a 3-month period of time. And in 3 months, the end of 3 months, that's generally when we start getting him into a lifting program. Some people, if they didn't get the surgery and they're just dealing with chronic FAI, in 2 months, they're usually a lot better, and then by the time we get in, right at the start of the 3rd month, we start getting them into a lifting program. But, he's pretty well through, so another like 1.5 months and he's gonna be good. Him, he's gonna take 4 months, because he just had the surgery, he's fresh, he's 3 months in. He's gonna take about 4 months to really get to the point where he can lift weights. But 2 months from now, I told him, he should be able to walk around without pain, sleep better, things of that nature, where he's more confident. Right now he doesn't have any confidence. So we're just having to push through this, and that 2-month marker, you should start feeling a lot better. And we could do like a follow-up video in 2 months from now too. Feels good? You got it.